a lot of people that have back pain, they've been having this pain for many years. And some people are maybe a weekend warrior and they've gone out and they've pulled something or did something to their back and they have an acute disc herniation or a sudden onset of pain. So that's another very common subset of people that I see. People with acute back pain tend to be in much more severe pain. It's a pain they're not used to having, and it's something that really alters their life quite significantly right away. People with chronic pain tend to have pain that they've endured for a long time, and they've already developed many coping mechanisms, and they're just really looking for a way to help alleviate some of those things with the chronic pain. Can some of the coping mechanisms be harmful? Yeah, sometimes people get such awkward body changes in the way they walk or the way they position or the certain way they carry themselves that's just not normal for them to have anymore. And after you do a surgery and you alleviate a lot of those symptoms, they may still have some of the bad habits, and that's why it's very helpful to have them work with our therapists to help retrain their bodies to be in a more of a better situation and awareness of how to carry themselves and to be different after a surgery. So what I look for when I'm looking at a CT or an MRI or deciding when is it time to take this person to surgery or when should we continue with conservative treatment, the things that I look at are really the duration of symptoms and the type of symptoms. If people have symptoms for 6 weeks or so or even longer, those are symptoms that tend to be less likely to go away on their own. Or if they've done injections or they've done other non-operative treatments or many of the other modalities like therapy or chiropractic, and they have been unable to achieve a satisfiable result in the decrease of their pain or increase in their function, those are the people you start talking to more about possibly being able to help them with surgical management. So what's changed in spine surgery over the years is instrumentation has been much more refined, really just since the 80s when we started doing rod fixation and things like that. Now we've developed pedicle screws and minimally invasive techniques where incisions have gotten much smaller, and the way that we are able to treat perioperative pain and control things have just gotten a lot better, and a lot of the techniques have been further refined to help people achieve better outcomes.